Good afternoon and welcome to CCK Live with Chisholm, and Kilpatrick. I'm Courtney Ross and I'm joined today by Michelle DeTore and Nicholas Briggs. And today we're going to be talking about VA's general rating formula for mental disorders. So we're going to start off with some general background information about the formula, and then we're going to take you through each specific rating and what VA has outlined as what the veteran needs to establish in order to obtain that rating under the formula. If you have any questions throughout the broadcast, please feel free to leave comments and we will do our best to answer them as we go. So just going to jump right into some general information. VA's rating criteria for mental disorders is primarily based on social and occupational impairment that's caused by a veteran service-connected psychiatric disorder. And it's broken down into different rating percentages. So a veteran can be rated at 0, 10, 30, 50, 70, or 100%. So like I said, we're going to go through each one of those throughout the broadcast. But I want to start just by noting that any rateable mental disorder is going to be rated under the same formula that VA uses. So common disorders that we see veterans suffer from include PTSD, major depressive disorder, schizophrenia, anxiety disorders. All of those diagnoses are all going to be rated under the same criteria. And one thing that's important to keep in mind too is that oftentimes veterans have multiple psychiatric diagnoses, and those multiple diagnoses might both be, or 2 or 3, however many there are, be attributed to service. But VA is not going to rate each separate diagnoses under this criteria. So for example, veterans who suffer from PTSD oftentimes also have a diagnosis of major depressive disorder. If VA has conceded that both of those conditions are attributed to the veteran service, the veteran's not going to receive a 50% rating for PTSD and a separate 50% rating for major depressive disorder under this formula. They're going to be rated together. And this is because of VA's rule against pyramiding, which is, generally speaking, means that they're not going to compensate a veteran for the same manifestations or symptoms and the resulting limitations of those symptoms that are attributed to multiple diagnoses. So if one of the symptoms or manifestations of MDD and PTSD is depressed mood, they're only going to compensate you once for that depressed mood. And it's going to be under the one rating for all of your psychiatric conditions that are attributed to service. So that's really important to keep in mind as we go through this criteria. It's also important to keep in mind that there are some conditions that are considered psychiatric conditions that are not rated under this formula, and it's very rare, but the prime example is eating disorders. That is going to be rated under a different diagnostic criteria that VA uses. So with that, Nick, I'm going to turn to you too, because in addition to eating disorders not being rated under this formula, there's also psychiatric diagnoses that don't qualify for VA benefits at all, right? Could you give us some examples of some of those?
Yep, absolutely. So the primary example that we often see are personality disorders, which are considered to be lifelong behavioral patterns that a veteran might have had since their childhood. So you can't get service connected for a personality disorder in and of itself. It's worth mentioning that just because you have a personality disorder doesn't mean you can't be service connected for a mental health disability at all. VA does still need to consider whether a veteran might have PTSD or depression superimposed on a personality disorder. But the personality disorder itself can't be service connected. Other things that pre-exist service that can't really be service connected are cognitive delays or developmental disabilities. And then finally, substance abuse and alcoholism can't in and of themselves be service connected. They can be treated as a sort of intermediary step, meaning if there's some service connected disability that causes alcoholism, like PTSD causing a veteran to drink, it can be rated as a part of the underlying service connected mental health disability. Or any secondary conditions that develop as a result of the alcoholism that is itself attributable to PTSD can also be related, but there needs to be that first critical step of establishing a service-connected mental health disability before substance abuse or anything like that can be considered as related to service.
And before we jump into each specific rating and what VA has outlined as what the veteran needs to establish, I just want to ask two questions of you, Nick. First, do veterans need to meet all of the criteria that we're going to go through? So all of the criteria that's listed in, say, the 100% rating to be able to get the 100%? And are symptoms that are not listed in that criteria, can they be considered? Can you argue those to VA? They might be attributed to the PTSD, but they're not specifically listed in that criteria. Can VA also consider those when deciding how to rate the veteran's condition?
So we'll start with the first question. Just because a veteran doesn't meet every single symptom listed in a specific criteria does not mean that they're not entitled to a rating, that particular rating. You'll see as we make our way through the list, each of the individual ratings assigned from 0% through to 100% for psych conditions comes with a specific level of occupational and social impairment associated, followed by a list of symptoms using the term such as, meaning it's meant to be a list of examples and not an all-inclusive list. So that being said, you don't need to meet every single symptom in order to be entitled to that rating. And you might also experience some specific symptoms that aren't listed, but that are similar in their content to symptoms that are listed that might allow you to be entitled to a higher rating. One example we sometimes see is the idea of skin picking, where a veteran might be so anxious that they pick at their skin and cause physical harm to themselves. As we'll show you, obsessive rituals that interfere with routine functioning can be considered equivalent to a 70% rating. Harm to yourself can be considered equivalent to a 100% rating. So even though skin picking isn't in and of itself a listed symptom, it's similar to other symptoms that are listed in the rating criteria. So that's one relevant example.
Thank you. And so keep that in mind as we kind of go through each of these different criteria, that you probably, as a veteran who's suffering from a psychiatric disorder, have symptoms that we're not going to specifically mention. And just keep in mind that that doesn't mean that you can argue that symptom to VA and arguing to get yourself a higher rating, or as an advocate to get your client a higher rating. So let's start with the highest rating, which is a 100% rating for mental disorders. Michelle, can you kind of take us through and outline what VA requires to establish a 100% rating for mental disorders?
Sure. With the 100% rating at this point, you're talking about total occupational and social impairment. So this means that the veteran's condition is so severe that they're unable to build or maintain social relationships. They're likely unable to work due to the severity of their condition. I will say we are probably of the mindset that you're unlikely to get the 100% rating if you are working. Is it impossible? No, it could possibly still happen. But based on kind of the wording of the criteria, it's very unlikely. So also here, you're talking about veterans who probably have gotten to the point where they're unable to perform the activities of daily living, which includes medication management, dressing, bathing, maybe cooking. A lot of times I see when a veteran is rated at 100%, it likely comes with an incompetency proposal, because a lot of times the condition is so severe that they're unable to, as we just said, manage their own medication, which a lot of times if you can't manage your own medication, VA kind of equals that with managing your own financial affairs. So the actual rating criteria, like Nick says, it says such symptoms as, and here it says impairment in thought processes or communication, regular delusions or hallucinations, difficulty separating fact from fiction, grossly inappropriate behavior. So when you think of grossly inappropriate behavior, it's kind of, there's no definition here, but sometimes you can see it based on the behavior that's happening. One thing comes to mind to me is harassment. But I have read examinations before where, the examiner will flat out say that somebody's kind of interactions during the examination are inappropriate. I think the one I read before where a veteran was sitting extra close to the examiner, was touching the examiner repeatedly. The examiner asked them to move away and not touch them. They were answering questions inappropriately. Those are things, you might see when it comes to grossly inappropriate behavior. You also, as Nick was mentioning, you have persistent danger of hurting oneself or others, disorientation to time and place. This is when you're talking about a severe level of memory loss too. You're talking about when somebody doesn't remember the names of those people close to them, maybe their own address, maybe their name, stuff that would be, regularly known to that individual. This is kind of what the 100% rating criteria encompasses right now for VA. But as we discussed previously, you don't need to have all the symptoms here. VA unfortunately sometimes does misinterpret that, but showing that maybe you have some symptoms or symptoms that are similar would possibly get you to the 100% rating.
Yeah, and keep in mind too that, again, this is the criteria or the formula that's used for all mental disorders. And so this might be symptoms that you're attributing to a PTSD diagnosis or to a schizophrenia diagnosis. This is still what VA is going to be looking at to grant you 100% rating for either of those diagnoses. So 70% is the next highest rating that can be granted for a mental disorder. And the language for this criteria is occupational and social impairment in most areas. So 100% was total occupational and social impairment, and 70 is most areas, meaning that the veteran typically struggles to maintain social relationships. They typically have an inability to really form new social relationships. They usually have serious difficulty securing and following employment. They're typically underemployed. I think a lot of veterans that we see who are rated at 70% are typically not working, or if they have attempted to work, they are only able to maintain jobs for brief periods because of their psychiatric conditions, or they're working in a occupational where they're only working part-time or earning marginal earnings because that's the extent of what they can handle with their psychiatric conditions. And so there's serious occupational impairment with this rating. They oftentimes have difficulty adapting to stressful circumstances, and so that makes it also contributes to their inability to work. Some of the symptoms that are listed in the 70% criteria include suicidal ideation, and ideation is important. The veteran doesn't need to show that they actually had made a plan to carry out the suicidal ideation or that they have had previous attempts at suicide. It's just the thoughts of it that is sufficient for the 70% rating. Nick mentioned this one before, compulsive rituals that interfere with daily activity. So the skin picking example that he gave obviously isn't listed specifically in the 70% rating criteria, but you could compare it to that part of the formula, which is the compulsive rituals. Illogic, irrelevant, or obscure speech, near continuous panic or depression that affects their ability to function independently. Impaired impulse control, so outbursts of anger or violence are a good example of that. Getting lost or disoriented, and so Michelle touched on this a little bit with the 100% rating when it's very severe and they have severe memory loss. This is contemplated by the 70% rating as well. It's just considered a lesser severity of it. And keep in mind too, a 70% rating, obviously if you have occupational and social impairment in most areas, typically if you have a condition that's rated at 70%, you have very severe psychiatric symptoms. While it might not meet that 100% rating, it's still going to be considered very severe. And so one thing you want to keep in mind if you're an advocate representing a veteran, or if you are the veteran and you're rated at 70%, is you want to take a look at, again, the occupational impairment and what the veteran's employment situation is, because he or she might also be entitled to 100% rating, but through a grant of what's called total disability based on individual unemployability, or TDIU. It's a different standard to get 100% rating. And typically, again, if a veteran's rated at 70%, their condition's severe enough to preclude them from securing or following substantially gainful employment, which is what you need to establish to get a grant of TDIU. I know in my experience, a lot of the cases I see where a veteran is rated this high, they are unable to work and they qualify for this benefit. And so keep this in mind too. If the mental disorder meets the criteria for a 70% rating, but doesn't quite get you to the 100% under the mental disorders formula, you want to make sure you consider whether that veteran might also qualify for TDIU, because it's an alternative way to get them 100% rating and the monthly compensation payment at the 100% rating. So 50% is the next highest level that's included in the formula. Nick, could you take us through what needs to be established for a 50% rating?
Absolutely. So when we're talking about the 50% rating, VA assesses this against the standard of occupational and social impairment with reduced reliability and productivity. Generally speaking, that means that there's some sort of regular impairment of work caused by the veteran's mental health disability. It might interfere with school if they're still participating in school. And it's also going to affect their social relationships to a lesser degree than a veteran who might have an inability to maintain effective relationships. So like I mentioned, they might struggle to maintain consistent work, and they might have some relationships with family members and friends, but those relationships can often be difficult or fraught. Um, Specific symptoms listed in the criteria include flattened affect, meaning difficulty expressing emotion, irrelevant remarks or talking in circles, meaning they have a hard time communicating their thoughts and feelings to other people, panic attacks more than once per week, which you'll notice in comparison to the 70% criteria, which requires near continuous panic. So there are similar symptoms noted across different aspects of the rating schedule. But here, panic attacks and anxiety generally are still happening pretty frequently, but not as frequently as the 70% criteria. Other symptoms include problems understanding complex commands, again, poor short and long-term memory, where they do still have some memory difficulties, but it's not rising to the level of the memory impairment contemplated by the higher ratings in the schedule, as well as some impaired judgment, difficulty with abstract thinking, and then mood and motivation disturbances generally. Again, these are all specific areas like judgment and thinking that are contemplated by the higher ratings, especially the 70% criteria. And the veteran may have impairment in those respects, but it isn't as severe necessarily as that 70% rating.
Yeah, and I would also keep in mind too that a veteran who might be rated at 50% might still qualify for the TDIU benefit I mentioned before. So you can see it right here. And Nick mentioned a 50% rating usually includes occupational impairment with reduced reliability, meaning regular impairment in work. And so a veteran who might be rated at 50%, maybe their psych isn't as severe to warrant a 70 or 100%, but it still has a regular impact on their ability to work in a substantially gainful occupation, which again might meet that standard that's required to for a grant of TDIU benefits, again, which is paid at the 100% rate. So just keep that in mind too, that while the veteran might only qualify for the 50% under VA's mental disorders formula, there's other benefits that might be available to them to get them a higher benefit, a higher rating, excuse me. So Michelle, can you take us through the 30% criteria and what's listed there?
Sure. So with the 30%, now you're talking about occupational and social impairment with occasional decrease in work performance. So it's a lower standard than the 100, the 70, and the 50. So at this point in time, it's only happening occasionally. So generally, the veteran is functioning with only occasional symptoms that may interfere with work or relationships. So in this criteria, symptoms may include, but of course, they're not limited to depressed mood, anxiety, panic attacks weekly or less often. So they're happening, but maybe not as often as they are in the 50% rating criteria. You're continuously having difficulty sleeping. Here comes, you see more of, the nightmares, insomnia, kind of stuff to that degree. This is when you have mild memory loss, such as, maybe not remembering directions, names of acquaintances, or recent events that maybe happened. And there also could be some more symptoms that fall under here, but these are the primary ones you're going to see in the 30% rating criteria. Again, this is when, it's just a little bit lower of a threshold where it's occasionally impacting or, work or your relationships, but maybe not consistently.
And then the 10% rating criteria is even less severe symptoms. So this is when you just have mild symptoms that interfere with occupational and social functioning, but really only at times of high stress. So even less than inconsistently. And usually the symptoms here are managed by continuous medication. But some of the symptoms that VA lists in the criteria, and again, this isn't limited to just what they have listed, but it includes mild depression or anxiety, mild or rare panic attacks, occasional difficulty sleeping, and there's others that are listed there as well. But the 10% rating criteria really means that the symptoms are pretty mild and don't consistently affect the veteran on a daily basis, only during times, like I said, of high stress. And like I mentioned at the beginning of the broadcast, there's also a 0% rating for the psychiatric condition. So, Nick, can you take us through that criteria and explain, what's the benefit of having a 0% rating, even if it doesn't mean you're getting monthly compensation for that?
Absolutely. So first, it's important to keep in mind how these disorders are diagnosed. By regulation, VA requires that psychologists provide a diagnosis under the DSM-5, the Manual for Diagnostic. I forget what the acronym stands for. But at the end of the day, there might be situations where a veteran has a formal diagnosis for PTSD, meaning they had a stressful event, they have symptoms and reminders of the experiences they had in service. They go through and they check every box under the criteria, but ultimately those symptoms don't affect their ability to work. They don't affect their ability to maintain relationships with other people, and they don't require continuous medication like the 10% criteria or the other criteria. So ultimately, it's still important to have VA recognize that the condition's related to service. One, because it is at the end of the day, especially with PTSD in particular or any other condition, it was granted in the first place because there's some element of your service that's contributing to some ongoing impairment caused by a mental health disability. The reason that it's important to get that established as soon as you can is because even if it's not that severe now, it might become more severe later. And it becomes harder and harder as the years go on to get service connection established, because oftentimes VA might try to deny based off of a supposed lack of continuity of treatment or symptoms. They're not supposed to do those things, but the earlier you can get service connection granted, the better. And that way, if and when your symptoms do become more severe, at that point, you don't need to fight for service connection all over again. You just need to file for an increased rating and provide evidence to help support that increased rating.
You're already over the service connection hurdle, as I say. So with all of that said, if a veteran is rated, like let's say they're granted service connection for PTSD and the VA grants them only a 10 or a 30% rating, what types of evidence could the veteran gather to submit to VA in support that they are entitled to a higher rating under this formula? Michelle, do you have some suggestions?
So a big piece of evidence here would be lay evidence, because keep in mind the psychiatric criteria is more subjective symptoms. So this is something that you can attest to and speak to. So getting lay evidence from yourself, maybe friends or family members that can attest to things that happen. Sometimes just treatment records don't have the full inclusion of everything, and being able to supplement the record with what is really going on with lay evidence is great. And, VA often takes lay evidence with almost the same weight as medical evidence. So that's something I'd really look into, especially for a condition such as a psychiatric one.
Yeah, absolutely. Nick, do you have any other thoughts on other types of evidence that a veteran could also submit in support of a higher rating?
Yeah, it's important not to forget about other forms of medical evidence that VA might not automatically have access to. Generally speaking, the rating decisions are going to rate a veteran's mental health disability based off of the VA exams and the symptoms that are noted within those exams. But there's going to be any VA treatment records if you happen to receive treatment through VA, as well as any private treatment records that you may have because you treat with a private physician, but VA hasn't been made aware of those records. In the legacy system and during the supplemental claim process, there is a duty to assist the veteran in terms of helping to gather some of this relevant information. So whenever possible, you should either provide these medical records yourself or at least provide VA with the necessary information so that they can make that initial attempt to go and get them. Because ultimately, your treating physician might have access to more long-term assessments and evaluations of your symptoms over the course of many years, as opposed to just that single snapshot of the severity of your symptoms on the day of a VA exam. So anything you can do to provide treatment records over a longer period of time, the better off you'll be in terms of getting that increased rating granted.
Yeah, and Nick, you make a really good point too, that usually in decisions, VA's just relying on that VA medical exam that they provide to determine what a rating is going to be appropriate. So in addition to submitting treatment records, one other thing you might consider doing is getting your own outside independent opinion from an expert, a psychologist, or someone who is going to have the expertise to assess the severity of your psychiatric symptoms, and submit that expert opinion in support of a higher rating as well. And it's even better if that expert has the ability to review your file in its entirety, including any lay testimony that you've submitted, any treatment records, as Nick indicated, including those VA exams that VA has already relied on. The more analysis that expert's able to provide in support of their opinion, the stronger and more probative that opinion is likely to be considered by VA. So keep that in mind too. With that said, Nick or Michelle, do you have any final thoughts or just general tips for if a veteran is seeking a higher rating under this formula, or any things to keep in mind when reviewing this formula and trying to decide what rating is going to apply to a specific veteran's case?
Yep. I do think it's important to point out that the VA examiners are asked to provide an assessment of what they think your level of occupational and social impairment might be. So they'll either opine on deficiencies in most areas, reduced productivity and reliability, occasional symptoms, so on and so forth. But that's been determined by case law, Vasquez Claudio versus Shinseki, and the other cases guiding the increased rating issue for PTSD. So that's determined to be more of a legal determination than a medical one. Meaning, even though the examiners are asked the question, their answer to the question isn't going to be determinative. Meaning, the board and the VA rating officers still need to conduct their own independent assessment of the symptoms and how they affect the veteran on a day-to-day basis before they can conclude what level of occupational and social impairment they experience. So it may be the case that all of the symptoms to show a higher rating are in the file, but for whatever reason, the VA examiner is offering that unfair characterization of what your impairment actually is. And you can always push up against that by appealing the decision to a higher adjudicator.
Yeah, and I think one other thing to keep in mind too is if VA is basing their decision to deny you a higher rating on a VA exam, you can also challenge that VA exam and the value of it. CCK has done a number of CCK lives on how to challenge VA examinations, what they're commonly called compensation and pension exams. So you can check out those videos on our website and our YouTube channel and Facebook as well, if you want some more specific information about how you might challenge a psych exam that the VA provides for you. Okay, well, thank you all for joining us. This has been CCK Live, and hope you all have a wonderful day.